I recently watched a video of Eagles wide receiver A.J. Brown talking about mental health in the NFL. And I just kept thinking, this is such an important conversation. Now, I've looked up to professional athletes my entire life. I'm literally in awe of them. I see them as disciplined, tough, mentally strong. And yet, here I am watching an athlete talk openly about anxiety and the pressure he's felt. And I'm really, really grateful that we've had athletes like Simone Biles and Michael Phelps speak publicly about their struggles too. The more people in the spotlight talk about mental health, the more normal it becomes. Because let's face it, mental health struggles are something many of our patients experience at some point in their lives. And if we're honest, probably something many of us have experienced too. Welcome back to the Exam Room Nutrition Podcast. I'm your host, Colleen Sloan. I'm a PA and dietitian, and today we're talking about nutrition for mental health. When a patient comes in with depression or anxiety, we think about therapy, we think about medication, and we should, but we don't always pause to ask, are they eating enough to support their brain? Are there any nutrient gaps? Is there any gut dysfunction? So today I'm chatting with Jennifer Haynes. She's a registered dietitian who specializes in the intersection of nutrition and mental health. We talk about the nutrition hierarchy of needs and why simply making sure someone is eating enough can dramatically impact their mood. We also talk about which supplements are helpful, what's overhyped, and when to be cautious. And we unpack why fueling our gut is good for the brain too. So get comfy or drive safe, and let's talk about how to truly feed the brain, not just medicate it. Jennifer, I'm so excited to have you on the podcast. I can't wait to get into this topic. Thanks for being here. So welcome to the show.
Yeah, thanks for having me.
Okay, I love how you talk about the nutrition hierarchy of needs. Can you walk us through what that concept means?
Yeah, sure. It's basically a framework or a visual, if you can imagine, like Maslow's hierarchy of needs. It's kind of a visual way to kind of think about like where we want to go next, where we want to start, that kind of thing. So everybody loves the tippy top, right? So essentially, if you're looking at that bottom section, right, like the base of the pyramid, that would be like shelter, food, in Maslow's. For nutrition, I like to think of that as like, is the client eating enough, right? So I see a lot of clients that are underfeeding for whatever reason. Usually it's chronic dieting, honestly, but sometimes medications are interfering with appetite, just stress and depression, just it alone can interfere with appetite. So I see a lot of people that are under eating, and literally the first thing we do is like, you need to eat. As much as we love to talk about like intuitive eating and mindful eating, a lot of times when people aren't meeting that baseline, they aren't capable of discerning hunger and fullness cues. So they don't necessarily know they're under eating because they're not hungry, right? So first step is to make sure they're eating enough. I usually tell my clients, like, whatever you want, and I've had people come back and say, well, I'm going to eat Pop-Tarts every day. It's like, have your Pop-Tarts. Like, first, we're going to eat enough, and then we're going to kind of move up from there. Most people don't want to come see a dietitian to be told it's okay to eat Pop-Tarts. So I do kind of lay some framework in there, but we need enough, like, I guess if you want to think about it like calories, we need enough calories in first, right, to get the brain using all of that stuff. And then the next little section is I think of it as the macros. You'll see it kind of listed out in different ways. But are we getting enough protein? Are we getting enough carbs, fiber, fat, things like that? And then the next section is where I start thinking about micronutrients. Diversity in the diet is really important. I start thinking about it there as far as, eating broccoli is great, but maybe we should have other vegetables too. Maybe we should add nuts. Are we adding beans? Things like that. So that diversity. And then that tip top, again, that's where everybody thinks like social media kind of puts nutrition at, right? This little tip top, the functional foods, like, am I going to take a supplement for this? The adaptogens, I heard St. John's wort, all those kind of things. That it's the very, very tip top. It's going to have the least impact, right? So this base is going to make a massive, almost immediate improvement in how they're feeling versus those, that little sprinkling at the top is going to have a little bit less of an impact. I like to think of it as a hierarchy, but also it's fluid in between. So like recently I presented and I made it a stair step instead of a pyramid because, sometimes we have a massive vitamin D deficiency or B12 deficiency from gut problems. And like, we need to correct that. They're not going to feel good, even if they eat enough calories, if they're, not absorbing their B12 or whatever. So it is fluid, but it gives us kind of like a framework to prioritize, if that makes sense.
Yeah, it makes total sense. And I really like that idea that it is fluid and you don't have to like, okay, we've mastered this before we can even move on to that. But it does simplify it and it ensures that the patient or your client has the basics down first. And I really, really like that approach. And so if for maybe a patient coming in and sitting with their clinician and they're like, oh, I heard, and you said, St. John's worts or whatever supplement, I want to take this. How would you like a clinician to answer that question, keeping in mind this nutritional hierarchy of needs?
If the supplement they want to take is not going to interact with their medications and they are just dead set on taking it, someone told them it was amazing, and I'm not going to argue with them for the most part. I will argue against St. John's wort and the supplements that are meant to put tryptophan into the brain. So 5-HTP, actual tryptophan, things like that, when they are on an antidepressant medication, could potentially be a very dangerous interaction between the two, especially with the St. John's wort. So that one I will argue against if I know they're on an antidepressant. Otherwise, magnesium is having its spotlight in social media. In reality, is it a magic bullet? No. Results, like scientific results, my clients are mixed on whether or not it actually helps them sleep. I think it just depends on the individual. But we also know that most people don't get enough magnesium, and a serum level testing isn't that helpful, right? The one thing I do maybe push clients on is when they are talking to me about how they can't afford to eat healthy or they can't do this or that, but they're spending $100 a month on supplements. Like maybe like, are these actually helping you? Maybe we could supplement that for this. Like, if you're spending $40 a month on a probiotic, maybe we could do yogurt and get protein and, some things like that. So it really depends. If we go in and invalidate their choices as far as supplements goes, a lot of time we lose them. They either think that we don't know anything and they've heard better from somebody that knows more than we, that kind of thing, or just invalidating them in general is generally not the way to help motivate change and things like that. So,
Yeah.
yeah, it just, again, everything's client by client, right?
Yeah, exactly. That's what makes nutrition so nuanced. And you can't really give like a yes or no, or, everybody, this is a green check mark for.
Yeah. Tell people the dietitian's favorite response is, well, that depends. And like nobody likes to hear it. And it makes our social media marketing or messaging like
Wah,
just not as
wah.
good as those
Yeah.
influencers. But yeah.
Yeah, for sure. Now, how would you find out if the client in front of you maybe wants to take a supplement is actually meeting those baseline enough calories? What are some good questions to kind of tease that out?
A really good indicator of not eating enough is no hunger cues, right? So generally the metabolism is going to adapt and those ghrelin, leptin hormones will shift. So somebody is under eating, their leptin's going to go up. They're not going to feel hungry, but they're also storing everything rather than utilizing it, right? So mental capacity is going down, things like that. So sometimes weight changes is a good indicator there. Unintentional weight changes. I think a lot of people think that if they're not eating enough, that they're automatically going to lose weight. And generally that's not accurate. And then are they having brain fog, fatigue that's not associated with the amount of sleep that they're getting? Is their anxiety or depression getting worse? Those are all good indicators they're not eating enough, because essentially the brain's going to shunt resources, right? So it's going to prioritize your heart beating, your lungs working, your kidneys filtering, right? All of that is more important than like a good mood, right? So if you are chronically under eating, the brain isn't going to work at full capacity, right? It's going to be slower. Your mood just not important at that point. So just asking people some of that, like, has your job been harder than usual? Emotional regulation is depleted, right? They might be snippier than they should be, things like that.
Yeah, I like how you look at other things besides just saying like, oh, how many pieces of fruit, how many veggies, how many servings of dairy, right? Like even our clients don't know that. So I think asking those other questions, like how is what you're eating affecting your lifestyle, your mood, your energy, your sleep? Those are going to be really better ways to determine if they're eating enough. And then you can work through those hierarchy of needs. So that's really helpful. Okay, let's talk about clinicians who are seeing patients with depression or anxiety. And I'm curious as to what are some red flags that a nutrition assessment, maybe with a dietitian, would be warranted. Like what should we be looking for?
I don't know if this is me being biased, right? I just think that they should be being referred to a dietitian, right? Somebody that is used to working with mental health conditions and knows the nuance and things like that. There's a lot of medication interactions and things like that you need to be aware of. A lot of black and white thinking, right? So it's helpful, like in an exam room, you don't have I have an hour and a half in my first session with clients, right? You don't get that in an exam room. So I guess my short answer is like, hey, I think there is some, room for nutrition improvement or a nutrition intervention. I would like to refer you to a dietitian. This may be helpful, right? Outside of that, I get it's not always helpful. So I really like for clinicians to keep in mind that depression and anxiety are strongly associated with inflammatory markers, right? And so that leads to a lot of comorbidities, so diabetes, heart disease, and IBS. So if you have an individual that is experiencing depression and something like that, now you have kind of a bigger reason, right, to refer out to a dietitian. All those things that we talked about, difficulty sleeping, irritability, the signs if they're complaining of being brain foggy and fatigued, that would be a good indicator to see to a dietitian. And then those unexplained weight changes or the client saying, I'm doing everything right and I can't lose weight. That's always a really good indicator of, just not eating enough. The body's holding on to anything it can get, right?
Yeah. Okay, so besides getting in enough calories overall, what other nutrition guidelines can a clinician share with patients who maybe do suffer from depression or anxiety that might be, realistic, evidence-based, that could really help them with their symptoms?
I think the biggest thing that in an exam room that you can do is just really emphasize that there's that interplay and that what we do that affects our body is going to affect our brain, right? The problem with trying to educate in the exam room is that we know education does not change behavior, right? I tell people all the time, if it did, then the doctor writing that you should have more fruits and vegetables on your discharge paperwork, that would be it, right? Oh, we need more vegetables, we'll go do it. So we really need to think about coming from this in a way that is there a baby step that we can take? Maybe we can get you started while we're finding a dietitian for you or, things like that. What could we do? Could we eat lunch because you haven't eaten lunch in 3 years because you're so, busy, or how could we make that work? We need to think about, are they on a medication that's suppressing appetite? And if it is there an alternative? Is there a something to do to kind of counteract that? Sometimes exercise can do that. A lot of times not necessarily in the outpatient setting, but when I was working in residential rehab, what really kind of helped them kind of frame of reference everything is I would talk to them about feeding their therapy, right? So psychiatric medications, they really do rely on that person being well fed to work at their best. It's not like they're ineffective without it, but they work better when you are well fed. So a lot of times if I can tell somebody you need to feed your therapy, your brain doesn't process therapy in the same way if it's underfed. Your medications don't work as well if you're underfed. Or alternately, sometimes feeding the gut bacteria would help them kind of conceptualize how things can kind of fit together.
I hate the word superfoods, but are there certain foods that you do encourage or recommend that can help with the mental status of a patient?
Yeah, I am really big on nuts and seeds. Not necessarily a particular one. I had a while that everybody was really dogging on cashews. I'm like, wow, they're one of the best sources of magnesium and zinc, and those are really highly implicated in deficiencies with depression and anxiety. So if we can get a serving of nuts and seeds in a day, we're going to get fiber and unsaturated fat and magnesium and zinc and all those things that if you look at research and individual nutrients are in those. I also really like beans. As many as people either love them or hate them, but if we could get them mixed in with other foods, something like that, at least 2 days a week, maybe 3, 4, depending on the person. And then if we can do some type of fermented food, fermented dairy in general has better research. That doesn't necessarily mean the other fermented foods don't help, but we just don't have the robust research behind it. But with foods outside of fermented dairy, we do have to make sure that they're actually fermented. A lot of the shelf stable products are brined, right? So, they're still a vegetable in that point, right? Like sauerkraut or kimchi, it's still a vegetable. It's just not fermented and we're not getting the bugs in there. But that tends to be better tolerated than a probiotic supplement for people with GI issues,
Yeah, no, that's really helpful. And it gives kind of a starting point or some quick tips that you can share with the patient for hey, let's try this out, see how you do with that. Like you said, while we're waiting to meet with the dietitian. Okay, you've mentioned a couple of times how the body and the brain are connected. And I like specifically that gut brain connection. And it's the science on that is so fascinating. And we're getting a lot of attention in that area. And so I would love to hear what are some of the common gut issues that you see that come alongside with mental health disorders?
Yeah, I think that most people that have looked at this at all are going to say IBS, right? And they're very highly coordinated, IBS between depression and anxiety, but really any gut issue, right? One thing that I've been trying to learn more about lately is SIBO, because while SIBO is not quite the same as IBS, they mimic each other. And anytime the gut is upset, angry, distressed, whatever, it's sending those distress cues up to the brain, right? So IBS is always one that we talk about, but celiac disease, it's not regulated. So the gut and the gut bacteria, right? They communicate with the brain through the immune system, right? So inflammatory. There's a few cytokines that are inflammatory that go and communicate that can direct like cortisol release and things like that. They communicate, those bacteria actually produce like bioidentical neurotransmitters. So serotonin, dopamine, things like that. Serotonin, as a side note, does not cross the blood-brain barrier. So producing, even though 90% of that is in the gut, it's not a direct impact on mood, right? We got to get that stuff into the brain to build there. And then they connect via the vagus nerve. So they'll talk back and forth with that. And so if we're sending distress signals up to the brain because our IBS isn't managed or, we love bread so much, we don't care if we have celiac or like whatever it is, right? It's going to be sending those distress signals up into the brain. But it can also work the other way. So if we get really anxious about, I'm going to use myself as an example, a presentation that is coming up at, fancy that brain being stressed out is going to go down. So you can think of like that nausea people get before they go on stage or, things like that. It can go back and forth along that vagus nerve.
Yeah. So it's so interesting. Okay. I want to do some myth busting because I'm sure you're on social media. And if you're anything like me, a lot of the influencer recommendations and interpretations of studies just drive me absolutely insane. But our patients are seeing this. And honestly, a lot of clinicians are too. And if they're not dietitians or they're not trained in nutrition science, sometimes those myths can sound really compelling. So I would love to hear in your space, what are some of those myths that you would want to just never be said and spoken about again in the mental health space?
There's so many. I feel like there's two big ones that I've been seeing that are specific to mental health. One is that on LinkedIn, I've been seeing a lot of chatter. I know the Academy is really pushing this like food is medicine, and I kind of get the idea of it. But like to some degree, I feel like we are setting ourselves up for a situation where somebody that can't eat their way out of a condition is failing. So there's some of that. I see a lot of chatter lately about like, if we can fix our nutrition, fix our environment, we can stop depression. We can get rid of it. We don't have to take our meds anymore. And like, maybe if we have like a very mild case, something like that, maybe, right? Maybe we're just feeling depressed because we're not eating enough and eating more. Now we have energy and we don't feel that way anymore, right? But in reality, giving out the impression that we can like cure depression or anxiety just with diet, I feel like is dangerous for that client. But also, obviously there's like liability issues and stuff like that. I would love to kind of get away from the talk about like stopping medications with nutrition interventions. But it needs to be really thought of as an adjunct care, right, to medication and therapy. And then the other one I don't hear it blatantly, like I don't hear anybody saying you have to be perfect or anything like that, but the way that like influencers talk, and sometimes people get really passionate about a topic and they get really excited, they make it sound like that person has to be perfect. You have to follow, let's just say, the Mediterranean diet perfectly, or it's not going to help, or that kind of thing. And there's really never a time where foods that serve a purpose other than nutrition don't fit, right? I mean, like maybe if you really love peanuts and you're allergic, right? But like, I mean, there's never a time where like I'm on the Mediterranean diet and I can't go have a chocolate cake because I want it, right? So this idea of perfection can be really damaging, especially to a group of people that generally are more prone to black or white thinking, right? And if we either blatantly or kind of accidentally in how we talk emphasize like or reinforce that idea of this like all or nothing thinking, we can cause some problems, right? Part of it, like with the keto craze for a while, the keto diet can be very socially isolating, right? You can't go out to dinner with your friends. You go to a birthday party and you can't have cake because it's going to ruin your ketosis and things like that. Anything that's going to socially isolate is not good for your mental health, right?
Yeah. And you mentioned something talking about like how kind of fear or even the perception of trying to be perfect can really spiral into restrictive and obsessive eating patterns. So how do you differentiate between healthful eating nutrition strategies that support mental health versus that advice that can spiral someone into that restrictive behavior?
I feel like to some degree, and this is not the best answer for a podcast, but like it's practice and like talking to clients and interacting, right? Ultimately, like if we can get rid of black or white thinking, like for instance, I never tell somebody like, let's cut out sodas this week, right? Like I always do positive goal. Let's add something. We're not going to retract, right? Basically to say that like those things are still there. They're fine, right? We can focus on other things, right? So there is that. If an individual feels really, really, really rigid, I make a suggestion and they panic. You're not eating enough, and they, like you can see a shift in their body language, either like a big rigid, or some people will actually like physically like start, like their body will jerk. If you see something like that, that's a pretty good indicator that maybe we have some disordered eating thoughts or patterns or anything like that, right? Sometimes I'll blatantly ask them, what if I told you that I wanted you to go eat a cake tonight? And, I could never do that. That would ruin everything, like that's a good indicator of it. Also a great place to transition into recommending a therapist if they are not already seeing one.
You've mentioned a couple times how we talk to ourselves, either about ourselves or about the food choices that we make. And I just wanted to share with you guys after this episode, go listen to episode 128. It's what I did recently with another registered dietitian. That episode is titled Silencing Food Noise by Finding Your Food Voice. And it's a really nice complement to this conversation that we're having today. So I will link down to episode 128 in the show notes. Okay, Jennifer, let's get to my final question. And we've talked a lot about food, but I want to hear if you do recommend or what the literature says about any of these functional foods or even supplements that are promoted for mood. When would these be appropriate to recommend?
Yeah. So I guess to start out is that this like field of nutritional psychology is really young. Like sometimes the research is really small studies. There's not a lot. There's a lot of gaps, right? I guess is where I was going with that. As far as the functional like nutrients and stuff like that, and fish oil is one of the first that I think of if people are specifically like for mental health, but it does help like with heart, disease as well. I have found it to be very highly effective in my clients doing fish oil. So the EPA in particular seems to be the oil in the fish oil that seems to work the best or be the most important for depression and anxiety. So, and usually that's a supplement, right? You're not going to get to that therapeutic dose that we're finding eating fish. Still eat the fish, don't get me wrong, but you're not going to get that high dose in fish. And so that's going to be somewhere around 1 gram of EPA seems to be where most research is indicating, but there is still some mixed research on it. If B12, vitamin D, I like those to be tested on anybody with a gut issue. So supplementing those. I'm trying to think of like specifically like functional foods. I think my biggest is going to be, again, those nuts and seeds, right? And largely because of magnesium in that situation. We don't generally as a population eat enough magnesium. And there is some thought that the RDA is actually set like too low. So if we're not hitting the RDA already, like if you can imagine how low we are on that. And so I talk a lot about just whatever nuts and seeds you can get in. The gut, I think, is where most people focus on functional foods right now. And like sometimes it's trial and error. I'm not a big fan of FODMAP unless I really have no other option. It is effective, but it also, it's restrictive and it's not great for a poor, relationship with food, that kind of thing. I have had clients do well with inulin supplementation, or usually any bar that you see that's labeled like prebiotic, it's usually inulin. It's really good unless you don't tolerate it, and then you feel horrible, right? And you're bloated and stuff like that. So I tend to not do that. People want to try it, that's fine. And, they'll come back and say, either it didn't work, it seems to be a little better, or like, oh my God, I had like gurgly belly all day long, or, it just depends.
Yeah, that's really helpful. Okay, this has been such an interesting conversation. Where can people hang out with you or learn more about you online?
Yeah, so I spend the most time on LinkedIn, and I'll give you the link for that as well, so you can find me there. And then my website is moodmattersdietetics.com. So I have a journal club there that you can look at if you're interested in like really dissecting research. We do that once a month.
Okay, awesome. Thank you so much. Definitely, guys, check out her resources. I will connect to all of that down in the show notes. But Jennifer, thank you so much for the gift of your time. I appreciate you being here today.
Yeah, thank you. Thank you for having me.